which we're trying to get into, but you can see the metal plate screws and metal cages from his prior surgery. Hold on. Shot. Yeah, it just keeps slipping. A lot of scar tissue from the prior. Give me extension. That felt pretty good right there. Shot. Yeah, it's a little bit too low. Shot. This is one of the hardest cases I've ever done, but I really want to help this guy. Give me an AP. So, this is an anterior cervical transdiscal endoscopic laser. Perfect. We're in perfect position. Lateral. We're right in the middle of the spine. You can see that on that lateral view. I've got to advance this tip into the front of the disc. You're going to need to give me extension. There you go. I know, but you give me your best. Yeah, we're really struggling here because of his scar tissue and his anatomy. Shot? We're right at the front of the disc, but I'm hitting the vertebral body below. All right, you're going to have to stop giving me that much extension because it's pulling my entire dilator north. There we go. We're going to hope that this works. I'm right up against his collarbone. Shot. That's perfect. Whew, this is not an easy one. Give me an AP view. Let's see where we are. We're trying to get into the disc through the front, right below his fusion. You see that? Perfect. Lateral. So we're in really good position on AP. The problem is I'm hitting his collarbone right here. See that? And I've got to angle up. But I knew there was an angle up on the disc before surgery that I still figured we had enough room to get in there, get the job done. And I still think that way. It's just really hard because the entire C3, 4, 5, 6 segment is stiff as a board. It's like totally fused. But he's got a herniation at the disc below. All right, let's get the tube in. We're going to do the whole surgery through a 4mm tube. Again, this is, it doesn't get harder than this when it comes to anterior transdiscal cervical endoscopic surgery for a disc herniation. Shot. Yep. Any questions? Shot.
At this moment, no current questions.
I don't know. Our incision may need to be made. Shot. I need to make the incision just about 1 millimeter bigger. Take that, take that. Of all the things holding us up now, it's the actual skin. So I made the incision bigger because the skin was holding our tube up. Now let's see if we can get past it. Shot. That's much better. We're in. Let's put this on top here. All right, now a little bit of inline traction, any of it would be helpful to open this disc up. Not extension, but inline. There we go. Yeah, it's working. You guys inlining? We're right below his fusion. You guys see that? We're in the disc just below the fusion.
Yes, we do.
We're almost back far enough. We're as far back as we can get. I'm going to try to put the dilator a little bit more because I need another millimeter. If I can get another millimeter, I'll be happy. You see that? I just need another millimeter. What is that? My God, it's your watch. I'm like, what the hell? All right, yeah, that's good. Very good. So we got our dilator in a little bit further to the tear. Now I'm going to try to advance this tube just a little bit more. Give us another millimeter of exposure. That's good. All right, again, this is as hard as this surgery can get. You're doing an adjacent segment below the fusion at C6-C7. The second most common disc to herniate and degenerate, C6-C7, but also the hardest disc to reach under normal circumstances. That's when the patient doesn't even have a prior fusion. Let's see. Is that what we got? All right, hold on. I need inline traction. Tell me when you're ready to give it. I need a shoulder pull. Okay? Give us a second. I need a shoulder pull and I need inline traction, and I'll tell you guys when. I need to get my other arm around here. All right, guys, on the count of 3. 1, 2, and 3. In line. Okay. Unfortunately, it did not work. You're giving inline, straight? All right, Luis, here's what we're going to do. We're going to do that again, but this time you take the chin, and I will try to get it out. We have another device. We do have our, what do you call it? Vice grip, but I don't want to use that. No.
Can we grab a vice grip, please, just in case?
I've got this. You take the chin. Let's go. All right. Well, there goes $1,000 piece of equipment.
Right there in the rack, yes, right there in front of you.
Gonna have to remove the dilator with a vice grip. So what's happening is the dilator tip is sticking out at the end. It's being compressed or crushed by the disc, by the bone above and below. They don't want to release this. So we're going to have to take it out with a vice grip, which is going to destroy the dilator, unfortunately. But can't leave this in the patient, so we have to do it. Whenever you're ready. Let's do all the usual stuff. Let's go inline traction. Come on, burn this. Mm-hmm. There we go. All right, we did it with the help of good old 100-year-old American technology, the vice grip. That's why we have the vice grip around in the surgery center. If people wonder, why do you have a vice grip? Sterile, right? Sterilely processed. This is exactly why. Sometimes we have no other choice. Any questions?
At this moment, no current questions.
Okay. You can see the angle of the tube. It's literally pointing down towards his knees. Very difficult for me to get in there and work, but we're going to do our best for him. We've already completed his facet treatment. Next. Huh? Nah. There it is. There's the herniation in the back of the disc right there. You guys see that?
Yes, we do.
Pretty damn cool. I need Ray Tech here. Any questions?
At
There's
this
no
moment,
questions. Let's show the audience how herniated discs cause neck pain and how we treat herniated discs with laser.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963. Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video how we use the endoscope to find the herniation stuck in the tear in the back of the disc. Are you guys ready? And then we use the laser to remove those herniations because they're always scarred down. Here we go. We had to change out our laser fiber because the laser fiber was not working. And there, that's perfect. All right, what was the issue with the other fiber? Was it the connector? All right, fine. Let's mark that fiber for checking, please. I'm going to flip. Any questions?
At this moment, no current questions.
All right. A lot of junk back here. A lot of herniation. You guys see that? Flip back.
Yes, we do.
The fiber keeps moving backwards. I can push it back in. What happens is the fiber gets pushed back by the water pressure, irrigation pressure. Yep. Man. Floating out a piece of herniation. Let's flip it. And we're going to have to disconnect the fluid maybe. Be prepared to do that. Yeah, because his chest is too big. I can't. Here, take that. Put it on the other side. Great, thank you. Yep, that works. It's teamwork makes the dream work. Watch this here. Oh yeah, you had it. Good.
We have a question
Sure.
coming from Hugh on Facebook.
Hugh on Facebook, welcome to our live stream from Deuk Spine. We're operating on a patient's herniated disc at C6-C7. It's been here a long time. Look at all this. That gold stuff takes years to make. It's not normal. It is calcium. This is calcifying this herniation. There's a piece of herniation right there, like a little rock. You guys see that? See how easy the laser cleans up that calcifying herniation. Not completely calcified, but it's like a rock down there. Yes, I'll take his question.
Asking, for those of us that watch on a daily basis, could there be a split screen ad so we can watch both?
Okay, yeah, I would love to do that. Any suggestions for improvement we take seriously. What do you want to watch again? What are they watching?
I
Like
think
in the operating room?
I think they want to watch like the endoscope and the camera simultaneously. Which
But this is the endoscope.
now they're saying they want to watch with the camera and the endoscope, like the overhead camera, alongside with the endoscope on the same screen simultaneously.
I see. Well, Henry, that's a question for you, my friend. I don't think we have the technology currently, right?
It's tough to say. I mean, I could add a camera in the operating room, but to add the overhead and the endoscope on the same screen, I don't think that's possible with the Crestron controller that I have.
It's not possible.
I don't think so. I can try. I can certainly try, but I can't guarantee it.
Mm-hmm. Well, maybe you can work on that as a project for when I am not here.
Yeah.
When I'm on leave. But Henry's got a massive backlog of videos to do right now. We got so many patient testimonials, and we've got a really good video coming out, folks, this weekend. It's on Tiger Woods. As many of you know, Tiger Woods has had 6 lumbar or lower back surgeries. His most recent was last Friday, about a week ago. And the truth is, had Tiger Woods come to Deuk Spine instead of gone where he did, he would never have had to quit golf. He would never have had to take in more than a week or two off of golf. We would have fixed him with laser, and he wouldn't have to have 6 back surgeries. Our patients have 1 back surgery. Sometimes they come back for a second issue. About 20% of our patients have to come back for a second problem. But the vast majority, 80% of our patients have come here. They have 1 procedure and their pain is gone for the rest of their life. That's it. Done. One and done. And that's what we could have done for Tiger Woods easily. He had 1 bad disc. Instead, he had 2 microdiscectomies, which is the wrong surgery for back pain. Microdiscectomies never, ever, ever fix back pain. Ever. He had microdiscectomy. They always make it worse. And then he had fusion. And then he had another microdiscectomy. And then he had like a laminectomy. And then he had an artificial disc just put in on Friday. So I need 5 minutes. Dr. Berndes, 5 minutes. Luis is doing an amazing job helping me switch the irrigation over to each side because the chest is so big. We just cannot get our instruments down. This 6-7 is by far the hardest disc in the world to do this way, which is anterior cervical. No matter whether you do a fusion, you do a artificial disc, or you do a laser procedure, the access to the front of the disc is almost impossible. Impossible for 95% of spine surgeons, truly. Only a few of us know how to get down here. And this guy, this patient, is unbelievably challenging because of his large chest. And look how degenerated this disc is. But despite all the degeneration, the laser is killing it. I mean, it is kicking butt. Destroying all the bone spurs and scar tissue. Just removing it. So doing a great job. We're going to work on the split screen, my friend. I can't promise you we can get it done, but we'll try. For those of you who don't know, Deuk Spine Institute is a small company. We literally have 1 building. We have 3 operating rooms. Patients come from all over the world because we work basically miracles of science and medicine. But the truth is, we're not a big corporation. We're small. And we're a mom and pop shop that happened to discover the cause and cure of back and neck pain. So we have limited resources, meaning we don't have a lot of money. We don't have any donors or investors. And most insurance companies try not to pay for the surgery. They try to get out of it, and they're successful to date, but that will change over time as we fight them in court. Thank you. Just about done here. I've done almost as much as I can. I got a little more I can do, and then we're going to be done. Any other questions from our audience?
At this moment, no current questions.
All right, well, look for that blog coming out. Henry has worked really hard, and so has Margie, and creating an amazing blog for you guys that's going to talk about it, but also a video that goes along with it to explain things. Again, that will be on Tiger Woods' 6 back surgery, which cost him over $1 billion. $1 billion. Hey, that would be a good title. The $1 billion back surgery.
I looked into it. Well, yes, that. He lost way more than that. It was between 5 to 12 billion.
Yeah, I believe it. I tell Margie
Yeah.
how back pain caused Tiger Woods to lose his career, his marriage, his basically respect and standing in the community. All right, let's flip it again. Basically, why did Tiger Woods lose it? Because he made the wrong choice. He chose the wrong doctors to treat his lower back pain.
Should have thought more out of the box.
Yeah, it's not entirely his fault. He relied on people to give him information, the wrong information, unfortunately, for him. And that's the whole point, is when you make the wrong choices about your health care, you can pay the price. He paid a massive price. Massive. Not as much as other patients who lose their life from choosing that choice. He still has his life at least, right? And he can still make the right choice if he comes to Deuk Spine Institute, but he doesn't know we even exist. That's the problem. Most people have no clue we exist. There's a piece of herniation. You guys see it? Just wormed its way out. We call that a reverse herniation. And it's really dense, full of calcium, but I still was able to float it up because Jordan did a kick-ass job with the irrigation. Thank you, Jordan. Irrigation. Nice, Jordan. Any other questions? Because we're done in about a minute.
Yes, we have a question from Mohammed on YouTube.
Hello, Mohammed.
Ask-
Welcome.
Asking, does lower back pain cause stiffness?
Yes, lower back pain definitely causes stiffness. But here's the thing, Mohammed. Lower back pain has 30 causes, okay? 30. And if you take away tumors, like cancer, you take away infection, like tuberculosis, you take away fractures. Take those 3 causes away. What you're left with is the disc injury, like this right here that you're seeing now. That's the most common cause of back pain. Facet injury, sacroiliac joint injury and inflammation, and then piriformis. So if you take those causes, which account for 99% of chronic back pain, that's back pain that people experience that lasts more than, say, 2 weeks, okay? Back pain lasting more than 2 weeks, 99% is due to either the disc, the facet, the SI, or the piriformis. So if you have pain coming from the disc is a joint. That means you have an injured joint. Well, if your joint's injured, the joint's where you do your movement, right? So if your disc is a joint that moves and it's injured and it's causing pain when it moves, you're definitely going to have loss of movement. Definitely, okay? On the other hand, if your pain is coming from your facet joint, you're definitely going to have pain with movement of the facet joint. So either when the disc moves, pain, or the facet moves, pain, either option is painful and it causes stiffness because that joint movement pain causes you to stop moving your joint. Plus, your brain says, oh, I don't want to move that joint because it's going to hurt, right? And then you also have arthritis of the joint, which is the arthritis of the disc. You're looking at it right now. The arthritis of the facet and the arthritis of the SI joint. Those arthritises of the joints, which is what's causing the pain, that's inflammation causing pain. Those arthritises cause the joint to be stiff because there's all this scar tissue. You see this disc right here I'm operating on? It's stiff, yeah. It's stiff because so much scar tissue holding the bones together, not letting them move like a normal joint. Sorry, guys. This is honestly one of the hardest I've ever done. I've done now 2,700 endoscopic spine surgeries in the last 20 years. Oh, there's a piece right there. You guys see it?
Yes, we do.
Let me try to get that out with the grabber. My pituitary rongeur. So yes, Mohammed, back pain and neck pain come from injured joints 99% of the time. And those injured joints become stiff because they have scar tissue in the joint holding the bones together, keeping them from moving properly. All right, I've got to get that piece out because it did not come out. It's right there. Here it comes. It's very heavy, this piece, heavy. And I have to take it up in the water. So it's not wanting to come out, so I have to chop it into smaller pieces. This name for this is bivalve, B-I-V-A-L-V-E, cut it in half. And it's a common practice in surgery where we bivalve lesions to get them out, make them smaller so they're easier to remove. All right, what is going on here? How's our irrigation? There's a piece right there coming out. Goodbye. Now I got to go get the other piece. Yeah, was it coming out the other side?
Yes.
Damn it. That's why. Any other questions? We're just about finished.
Yes, we have a question coming from Mike on YouTube.
Mike, welcome. Before I take Mike's question, I just want everybody to look here. That laser fiber, the glass thing at 12 o'clock on your screen, is literally 0.5 millimeter, half a millimeter. It looks huge, but it's not huge. It's small. Now, we are looking at the back of the disc space. You can see the back of the disc is about 0.5 millimeters, right? It's not much bigger than the glass fiber. So it's collapsed. This is called degenerative disc disease. When the disc is completely collapsed and the scar tissue is scarring both sides of the bone to each other so that the joint does not move normally. It just does not move normally. Yeah, this answers the question Mohammed had about stiffness of the joint. Just about done. I keep wanting to get a little bit more. I want this patient to be happy with his results and pain-free. And I think this is the last right here that I can get. That's about it. The rest is too much. We never get 100% ever because it's impossible. We cannot. The best we can do is 60, 70% of the herniation. And that always gives the patient great results. The patient's always happy and they're pain-free for the rest of their life. All right, that's it.
Sit it down, please.
We're going to float out the rest of that, but we're done. We were successful at finishing the surgery. Can we suck this other bag, please? It's full of liquid on my side. Any other questions?
Yes, from Mike once more on YouTube asking,
Mike.
is the floating herniation coming off the nerve root, and can you explain what we are seeing?
Yeah, Mike, you're right. So down there at the bottom is a crack. Beyond the crack is the spinal cord and nerves. That's what gets pinched when you have a herniation. The herniation is when the disc material went out through the back. Give me a little inline. Little inline. 1, 2, 3, go. Perfect. Done. Check that tube. It may be bent a little bit. Make sure you verify. All right. So at the bottom of that crack, what we were looking at, a chasm, beyond that is the spinal cord and the nerve roots that come off the spinal cord and go down the arm. So we were looking at the epidural space and the spinal cord, the front of the spinal cord. Just behind that was the posterior longitudinal ligament, and the dura is beyond that. So we did a decompression in the center of the spinal canal, and then we did a foraminal decompression by getting the pressure off the nerve roots. Okay? And I don't know, to the left was the end plate of C6. To the right was the end to the right was the end plate of C6. To the left was the end plate of C7, and we were looking between the end plates. There it is. The incision is tiny. No fusion necessary. This patient never should have had a fusion, but he went to another surgeon. They recommended fusion. They did a fusion in the front. They went in the back. They got lots of money doing fusion, but it's bad for the patient. Patients should not get fusions anymore. Come to Deuk Spine, get the next generation of spine surgery, laser, endoscopic, Deuk laser disc repair, not available anywhere else. Soon to be available in Saudi Arabia. Once my Saudi Arabia neurosurgical friend comes out here to work with me, or I come to Saudi Arabia to teach them. All right? We're going to improve Anglo-Arabian relationships by working together collaboratively in medicine to help patients on both sides and the whole world. Thanks for joining us. Henry, anything else?
Yes, one more question from Mike once more on YouTube asking, what were his symptoms?
This patient had neck pain, headaches, and then pain going from the neck into the shoulders, called cervical brachial pain, down into the shoulder, and then into the arm, numbness and tingling and weakness from a pinched nerve. Okay.
That is it for questions.
Have a wonderful day. We're going to be back in about 30 minutes with our next patient. She's very complicated. She has a herniated disc we're going to fix, and then we're going to fix 2 SI joints, facets, and a piriformis. And we have 2 more surgeries after that.